So one of the advantages of deep brain stimulation is that when the device is turned off, there are no side effects, or should not be any side effects. When the device is turned on, you can see side effects, but that depends upon where the leads were placed. This is one of the major reasons that the patient is awake for the surgery when we implant the leads. The leads are implanted, we then turn the power onto these leads while the patient's awake and interacting with us. And we often turn the stimulation parameters higher than they will be when the patient is out in the world and functioning, looking for side effects. For example, if the leads are implanted too far anterior, the patient may see flashing lights. In another location, the patient may have some difficulty with speech. These are things that we would pick up in the operating room and be able to move the lead accordingly, ideally placing the lead where the patient doesn't have any side effects. If we are unable to get the lead into a place that has no side effects at all, another tool that we have is we can actually set up multiple programs. In other words, if a side effect that the patient is seeing is a little bit of slurring of speech when the device is turned on, we can set up a program that limits slurring of speech but allows the patient to for example, speak on the phone. And another program that would give some slurring of speech but would allow the patient to walk better. And all the patient would need to do is toggle between program A and program B, depending if they're talking on the phone or walking around a store. This is something that's very, very easy for the patient to do. The patient has a device that looks a lot like an iPod that they're just able to press several buttons and just toggle between programs.